This is a really great question. And really the question comes down to, how can I tell the difference between Hashimoto's and hypothyroidism based off symptoms alone? So let's talk about that right now. Unfortunately, there's a lot of overlap between patients who have Hashimoto's and patients who have hypothyroidism. In addition, the number one cause of hypothyroidism, at least in the United States, is Hashimoto's thyroiditis, which is the autoimmune disease of the thyroid gland, which results in low thyroid function. So a lot of the symptoms between the two states overlap. So one way that you can tell the difference is by ordering your thyroid antibodies. So if you have hypothyroidism that isn't caused by autoimmune thyroiditis, you will almost always have negative thyroid antibodies. Now, this isn't always true because there are situations of seronegative Hashimoto's, so you may actually need to look at a thyroid ultrasound or find some way to image the thyroid gland to see if there is any inflammation. If you find inflammation or white cell infiltrates inside of the thyroid gland, that is the hallmark of Hashimoto's thyroiditis. And at that point, you can pretty definitively say that your thyroid disease or your low thyroid state is caused by Hashimoto's thyroiditis. Without the addition or without evaluating these lab tests, it's going to be very difficult just based off symptoms alone to determine whether you have Hashimoto's or hypothyroidism. Both of these symptoms, the symptoms of each of these conditions, can lead you to look at your thyroid, but they may not be definitive in terms of telling you what exactly is going on inside of your body. This is yet another reason why it's so important to get a complete thyroid lab panel if you are evaluating your thyroid. If you go into your doctor and you get this full thyroid lab panel, you will almost always find out in the very beginning that your thyroid disease or low thyroid state is caused by Hashimoto's. But you will only know that if you order that full panel because it includes your thyroid antibodies. So many thyroid patients go in and all they get tested for is TSH or free T4, if they get free T4, and they'll be diagnosed with hypothyroidism without actually being evaluated as to what caused the hypothyroidism. And if you fit into that category, it's very possible that you could have been diagnosed with Hashimoto's had they checked for it correctly way back in the beginning, but you had no idea and you've just been living your life for the last 20 or 30 years as a hypothyroid patient when in reality, you actually had Hashimoto's. And believe it or not, that's actually fairly common.